the record. We have had some people ask if they can record and will broadcast it. It is fine for you to do so. I will ask that you also check your inboxes. You should have received the news release that we have issued that has some of the information we'll be sharing today. If you did not receive it, please shoot me an email, Shelley, SHELLY.Walther@tn.gov, and we'll make sure you receive that. It will also be posted on our online newsroom on our website. So we will begin with some remarks from Dr. Piercy. We will have time for questions at the end, and I believe today we will be able to go until 2:45 if we have questions continuing if we have time. So with that, we will begin.
Thank you, Shelley. Good afternoon, everyone. I have a pretty substantive update today, and we'll be sharing quite a few details and numbers. Those are in the press release, but I'm happy to repeat those later if you didn't catch them the first time. So our top line today is to tell you about some things that we've uncovered in Shelby County and to let you know what we found as well as what we plan to do about it. The purpose of my comments today is not to place blame at all. It is to solve problems. The people of Shelby County deserve to have
Dr. Piercy?
And life-changing. Yes?
You froze on us for a moment.
Okay, I hope we don't have those problems today. Sorry about that. If that continues happening, we can change that up. So I'll start over. What I want to bring you today is some information on what we have uncovered in Shelby County, because the people of Shelby County deserve efficient and effective vaccinations. It is our largest population center. It is also one of our centers of color as far as disadvantaged and minority communities. But the people of Shelby County deserve to have good access to vaccine. And so this is all about solving problems and making sure that they have that access. This is not about laying blame or pointing fingers. So I do want to start out by telling you that, like you, we have heard reports over the last few weeks of some concerns and some inefficiencies. You've heard me reference in this venue before that we have been working with them, not only the Shelby County Health Department, but more directly with the city of Memphis within the last week or so. We have provided some enhanced reporting as it pertains to doses being delivered. We've been working offline and in the background on this issue. However, as you know, on Friday, February 19th, there was a public report that over 1,000 doses were wasted after being expired in the pharmacy at the Shelby County Health Department. That was very concerning to us. That was new information to us. And so we immediately deployed a team to Shelby County that included our director of our vaccine program, director of emergency preparedness, as well as a lead member of our unified command group. When we got there, we did find the 1,315 doses that were reported to be expired. I do want to pause and give you a little bit of clarity on some of these numbers that I'm going to be giving you. You may remember that several days ago, maybe a week or two ago now, Pfizer changed their packaging to where the vial each now has 6 doses instead of 5. So this 15 doses is based on 5 doses per vial. If you use the 6 doses per vial, which is now the official count in those vials, that amounts to 1,578 doses. We found that, we first found that those 1,600 or so doses, 1,578, happened over 6 expiration events dating back to February 3rd. I recognize that there has been some weather statewide, but specifically in the West Tennessee area, even prior to the storms, the snowstorms in Middle Tennessee and the rest of West Tennessee this past week, the weather events in Shelby County and in West Tennessee were earlier than some of the rest of the states. However, that went back to the 11th or the 12th. That did not go back to the 3rd. So we believe that the majority of this wastage was not weather related, that it was actually 6 different expiration events that occurred between February 3rd and February 12th to total, again, 1315 or 1578 with 5 and 6 doses respectively. The other thing that it is not related to, they were not doses that were taken out into a site and then people no-showed and they had to bring back. These were doses that, for what we understand right now, never left the pharmacy and were allowed to expire on site there. The other thing that we found when we came on site is we found 51,000 doses in inventory. Now, I want to put that in context for you because some inventory is expected. You have to be able to plan ahead about a week in advance, even a little bit longer, perhaps up to 10 days for those getting ready to get a second dose. By our calculations, we are estimating that they should have had about 20,000 doses in inventory. And so when we found 51,000, again, that's using 6 doses per vial, we found in excess of 30,000 doses on the shelf in Shelby County Health Department. These doses, fortunately, were not expired, and the earliest expiration date of these excess 30,000 doses is March 6th. So we still have a couple of weeks to use up that inventory. When we were on site last Friday, we also found a lack of standard operating procedures for storage and handling of vaccine. We found no formal process for management of soon to expire product. And we also found that there was no ability for Shelby County Health Department personnel to access the pharmacy in their own building. So to explain that relationship, as I understand it, that is a contract pharmacy or pharmacist that Shelby County employs. It is embedded in the health department. That pharmacist is technically an employee of a health system, but is assigned exclusively to Shelby County Health Department and has worked there for quite some time. We understand that the pharmacist had sole access to that pharmacy and that Shelby County Health Department leadership was not able to access that without the pharmacist present. So that was on Friday. Our team arrived on Friday night around 7:30, stayed there well into the evening, and then went back on site on Saturday morning, the 20th. They left mid-morning or late morning on Saturday, and then we returned yesterday on Monday, the 22nd. Yesterday, later in the day, we also discovered that there was a 7th expiration event that occurred on February 15th. That one was weather related. That was Monday of last week when many sites in the state had to close down. That was an additional 850 doses to bring the total, if you use 6 doses per vial, to around 2,400 doses in 7 different expiration events since February 3rd. Unfortunately, that February 15th expiration was not disclosed when we were there on the 19th, but was rather disclosed yesterday on the 22nd. These are the facts as I understand them. I will remind you that this is an ongoing investigation. We have people on site today, and you'll hear more about that in our action items. But again, I want to reiterate, this is not to point fingers or place blame. This is because the people of Shelby County deserve efficient and effective access to this vaccine. And so not only are Shelby Countyans important to us, all of us in the state, but the performance of Shelby County is important to our state's performance as a whole. Shelby County accounts for about 14% of the state's population. And now that we're doing population-based allocation, that means they get about 14% of all of the doses statewide. And so when that is not maximally efficient, it brings the entire state's performance down. But that's not what's important here. What's important here is that people of Shelby County are able to get the vaccine as quickly as possible. So I want to tell you about our action items to date. These could change. They could be added to or taken from as we learn more information. But I first want to reassure you that vaccination efforts in Shelby County are full steam ahead. There is no time that we are taking any sites offline. they're vaccinating today. They are doing it the rest of the week. We are doing everything we can to make sure that those events and those sites remain live and active. And I want to make sure you understand the difference between allocation and administration. They're really two different buckets, although they are related. So all of the issues we're talking about have been in allocation and in the management of that. If you want to think about it, like that's what happens in the office and in the pharmacy. There is another set of issues that happens out in the field where these are actually being administered. And if you don't have a good process for allocation, your delivery of vaccine might not be as efficient as it could be. But right now, we're focusing our efforts on the upstream part of that, which is the management and allocation of the inventory. And then we also understand that there are some issues with some of the sites where vaccine is actually being administered, and that's part of our action plan as well. So our action items include full-time embedding of both Department of Health staff and then soon to be CDC staff on site at Shelby County Health Department. That began yesterday. Our team arrived just after lunchtime yesterday and plan to be there on site for the near term. I suspect that will probably be anywhere from 2 to 4 weeks. We have requested CDC assistance to be on site there for 30 days and are awaiting that personnel to be deployed. Those people that are embedded are subject matter experts. They are pharmacists, they are vaccine management experts in storage and handling, and they are there to provide technical assistance as well as monitoring while we continue this investigation. I'm oftentimes asked, why don't you just take it over and why don't you do it all yourself? That's not the point here. The point here is we don't want to slow Shelby County down. If we were to take everything over or to get a third party to take everything over, there would be a necessary slowdown, and we don't want that to happen. We want to come alongside. We want to provide assistance as well as education and training on how to move forward. We are also taking the current inventory that is in the Shelby County Health Department and distributing them to partners who can immediately deploy these. You may not be aware, but there are dozens of sites in Shelby County that have vaccine right now and are giving vaccine. I think people get into the mindset that they're only coming from these very large sites, but there are dozens of sites across Shelby County, including pharmacies, hospitals, clinics, as well as both the City of Memphis and the Shelby County Health Department sites. And so all of the inventory that's in Shelby County right now is being taken out, removed from the site, and given to those partners for immediate administration. Again, those excess doses have an expiration date no sooner than March 6th. So we do have a couple of weeks to effectively use those doses. The other thing I want to reassure you is that Shelby County will continue getting the same population-based allocation. We are not reducing the number of vaccines that are coming to Shelby County, but what we are doing is we are no longer sending them to the Shelby County Health Department for the time being, but rather sending them to the other. I'll just ask that everybody mute their lines, please. The primary partner or partners in that mix is the City of Memphis, as well as multiple hospitals, pharmacies, and FQHCs, as well as some safety net clinics. We are, as I mentioned a minute ago, transferring the physical assets out of Shelby County Health Department. And additionally, we are instituting daily phone calls with Shelby County Health Department leadership and our vaccine management or our vaccine program here at the central office at the Department of Health. That is in addition as a supplement to the on-site assistance that we're providing. Going forward, there are a couple of other things that you should probably anticipate. We think that it is likely that there will be some type of inquiry from our federal partners, specifically the entity formerly known as Operation Warp Speed or the CDC, and perhaps other federal agencies that have an interest in this very valuable federal resource. We also, in the process of being embedded down there, will begin to look at how efficiently the sites, the distribution sites where the actual vaccine is being given, how efficiently those are run, and if we can identify any processes that can be improved there. But right now, I want to stress that our primary consideration at this moment is making sure that the vaccines are safe, that they're stored and handled properly, and that they are used in an efficient manner. You know, a good partnership is built on trust and honesty and transparency. And as I've mentioned twice already today, we have a vested interest in making sure Shelby Countyans get this resource. And so that's why we took a very swift and definitive action in order to be able to mitigate any of these issues and to prevent any of them going forward. This is an evolving situation. We do anticipate that there will be updates later in the week, and so we're happy to give those to you as we learn more, but we will keep you updated on this situation. I also want to address briefly about where Tennessee falls in the national rankings. As you may have seen, we have fallen down the list on first doses. We still rank 20th overall in all doses administered. That's pretty commensurate with our population ranking. I believe we're the 16th, perhaps 17th largest populated state. And so to be 20th overall in doses is pretty consistent with that. I will tell you, if you look at our numbers, the second dose population is pretty robust. That is a product of us having very early success. So we had so many first doses delivered very quickly. We have focused a lot of recent efforts on second doses. You've heard me say many times that Tennesseans are guaranteed a second dose. If you got your first dose in Tennessee, you're guaranteed a second dose. And so we've been focusing our efforts on that, but it has caused us to fall in the rankings of first doses. But there are a few reasons for that. There is a well-documented trade-off between equity and speed. And you've heard many sources, including myself, mention how big of a focus we have on equity. Vice President Pence, as well as Director Redfield, former director of the CDC, has named our plan as one of the most equitable plans in all 64 states and territories. That means that we are trying to get this vaccine to those at highest risk, both from age and medical conditions and highly vulnerable populations based on their workplace. We're trying to get that to them first. And the good news is we've done a really good job of that. We exceed the national average for 75-plus-year-old vaccinations by 25%. I'm really proud to say that 57% of all Tennesseans age 75 plus have been vaccinated. And you know that that is the population that is driving our hospitalizations and deaths. And so we have a very risk-focused plan, and our plan is focused on getting doses to the people at highest risk first, and that's what we've done. Secondly, I can't ignore the fact that our largest population center and the issues that we've been describing today with inefficiency are kind of pulling down the whole state's average. That is not to say that it is that's the single factor, but that is a contributing factor to our national ranking. And thirdly, it doesn't affect only Tennessee. It's not unique to us. We've been shut down on vaccine administration for about the last week because of the ice storm and then the multiple winter storms that we've had over the last several days. And when you look at the rankings right now, you will see several of the southern states really falling in the rankings because of that lag in distribution because of weather. So I wanted to reassure you that we're keeping an eye on that. We know why that's happening, and we're pressing forward. A couple of more unrelated updates, and then we'll be happy to take questions. One is that later this week, you will see information about a change to our visitation guidelines at nursing homes and long-term care facilities. That new guidance goes into effect on February 28th, so Sunday, and there'll be more information later this week. But essentially, because most of our nursing homes are completely finished with vaccination. In fact, 100% of our skilled nursing and nursing homes are finished with both first and second doses, and about 3/4 of our assisted living facilities are finished with their second dose. So we're almost completely finished with 100% vaccination at all facilities in Tennessee. After that vaccination is complete, which is scheduled to be at the end of this week, we will no longer be restricting any visitation at nursing homes they will only be under the restrictions of their governing body. In this instance, it would be CMS, the Center for Medicare and Medicaid Services, specifically for nursing homes and skilled nursing facilities. There'll be more information later in the week on the details of that. And then finally, the other thing that we're excited about this week is that, as you know, the FDA is scheduled to meet later in the week and is expected to approve the Johnson & Johnson vaccine. That is the one-dose vaccine that it is 100% effective against hospitalization and death, just like Pfizer and Moderna, with the added convenience of only one dose. So look forward to having that in state, perhaps as early as next week. And so when we get more information about that, happy to share as well. I'm sure there are quite a few questions, so I will stop there and ask Shelley to moderate some questions. I do have Dr. Shelley Fiscus on the line with us today. She is the medical director for the state vaccine program. She was on site in Shelby County on Friday and has been intimately involved and is here to help me answer questions. All right, Shelley.
Yes, ma'am. Our first question will be from Kimberly Crucy with the AP.
Hi, Dr. Piercy. I was wondering if you could provide a little bit more insight about how a 30,000 excess can happen. I guess I'm a little confused about the tracking, if they just didn't have to report that. I was curious if maybe you could provide a little bit more insight about how that happens.
That's a good question, Kimberly, that I'm not sure I have full visibility on. It's a legitimate question and one that I share with you. It has actually been noticed in the system for a couple of weeks now. We've been asking about it. We're initially told that it was a lag in data entry, that those doses were actually, or a portion of those doses had been administered but hadn't been put into the system. But that inventory number really never went down. And so when we came on site, we did a hand count of that inventory and found the 51,000 doses. So that would be a good question to direct to the Shelby County Health Department.
Our next question is Grace King from WBIR.
Thank you, Dr. Piercy. Many of our counties still have waiting lists with thousands of names over in East Tennessee. Some are in that high risk 70+ age group you're talking to, but we're seeing kind of separate lines being created now for those K-12 educators that are, in a sense, allowing them to skip ahead of people 70 and older. What's your message to those seniors who feel like they're being cut in line?
So our plan contemplates simultaneous phasing of both age and risk-based. So both of those age groups are in phase right now, so neither one is cutting in front of the other. However, I will tell you that because of school hours and teachers who are in school, which is where we want and need them to be, we are in many instances offering after school hours or evening or weekend hours for teachers to be able to come over and get vaccinated in a special, what we call pod, whether that is either on site at the school or at the health department or another location, because most of the time teachers can't get over there during our normal business hours. And so that's what that is for. But no one's skipping ahead when our plan contemplates simultaneous phasing.
To kind of follow up on that, I know in Anderson County, at least, they are a vaccination site, the school district. They're being shipped directly to the school. Is that taking away vaccines from people 70 and older in line? Is the county allocation the same if some are just going to the school district?
So it is a zero-sum game. At the end of the day, there is a set number of vaccines that come into our state. And that could be the downside of simultaneous phasing, which is when there is a limited number, by default, if a younger person gets the vaccine, then they by default are not, that vaccine is not able to be given to an older person. That is appropriate in our phasing, but it is, the fact is not lost on me that the 70+-year-olds are at medically much higher risk. And so if there are anybody in a workforce, whether it's healthcare or teachers, whatever, if they are younger and healthy and don't have risk factors, and specifically if they have had recent infection in the last 90 days, it would be the courteous and civil thing to do to kind of step back and let an older person go ahead of them. But it's not inappropriate for them to get vaccinated now.
Thank you. Our next question is from Alexandria Adams at WSMD.
Hi there, Dr. Piercy. A couple questions for you. What are you all doing to make sure that this doesn't happen anywhere else in the state, as far as adding more training? And then also, is the weather and the loss of the vaccine in Shelby County going to push back any phases across the state? Thank you.
Good question, Alexandria. So your first question is about essentially how do we make sure this is not happening anywhere else in the state, and about training and processes. It brings up a good subject that might surprise you, and that is just about management of vaccine in general. I know all of us think that this vaccine is new and novel and we've never seen anything like this. But actually, except for the ultra cold storage and the dry ice component, this vaccine is managed the exact same way that every other vaccine has been managed for decades. There are inventory and storage and handling and process requirements for every vaccine, whether you're talking about flu vaccine or polio or MMR or anything else. This is standard operating procedure for all vaccines. So I don't want you to get into the habit of thinking that there is some type of special training for this. Yes, there is special handling because of the ultra cold storage for Pfizer, but otherwise the process is the same. So for the rest of the state, or for the state as a whole, both in our metro partners and in our 89 rural health departments, there's a very robust set of check-ins as well as reporting structures on the local, regional, and state levels to make sure these processes are in place. With our metro partners, as you know, they are much more independent and don't necessarily report to the state, but they do have that accountability. And it's through these accountability check-ins that we first became concerned and then were further confirmed when the announcement was made last week about the doses. And I forgot your second question, I'm sorry.
Hey there, yeah, my second question is the weather and the loss of the vaccine in Shelby County going to push back any phases across the state?
So yeah, that's a great question, because Shelby County certainly wasn't the only place that had a weather event last week. Most places in West and Middle Tennessee had significant disruption last week because of the weather. So it doesn't change any of the phasing. Just as a reminder, we went to 65 plus and 1B, which is our teacher phase. That started yesterday, and so now that is available statewide, except in areas of usually larger areas in metros that are still working through the 70 plus population. So the phasing itself doesn't change. However, a lot of sites are playing catch up this week. And so they're taking the appointments that were supposed to happen last week and then putting them on top of the appointments this week. And so they're sort of working double duty. Many of our health departments are extending hours into the evening. They worked over this past weekend. They'll be working this coming weekend. They won't be 100% caught up this week. We expect it to take about 10 or 14 days to get through all of that process, but they will be doing catch up this week and regular vaccine this week. Which also reminds me to please reassure your listeners and your viewers that you have up to 6 weeks from the time of your first dose to get that second dose. When you get that date written on the card, when you get your first dose, that is the earliest you can get it. You do not have to have it on that day or even a day or two plus or minus. You actually have 6 weeks from the first dose. So even a week's delay in weather is not going to put anybody out of range.
Thank you. Next up, we have a question from Kelly Roberts at WMC.
Hi there. It looks like, along with this investigation into those doses that were wasted, a lot of other things were found when it comes to procedures and especially, the access to the pharmacy, the procedures that would cause those excess and inventory to exist. Can you explain exactly, what caused this lapse that created this wastage? Is it all those combined? Is there one thing in particular that you guys found during this investigation that seems to be the pinpoint operation, or something that at least was fairly concerning?
I I'm going to make a brief statement, and then I'm going to let Dr. Fiskus answer that question since she was on site. But I want to explain something that we know about in the medical industry and healthcare field, and that's what we call the Swiss cheese model. When you have a failure of a system, it's almost never one particular thing. It's when all of the holes in the Swiss cheese line up. If you had a stack of Swiss cheese, there is going to be a spot where all of the holes line up and things fall through. That appears to be what's happening here. It's not one single thing, but a combination of multiple things. And I'll let Dr. Fiskus give you some more detail.
Yeah, thanks, Commissioner. So I think the biggest issue that we found was just a lack of communication around the thawing of vaccines. So as you know, with those Pfizer vaccines, the minimum tray of doses is now at 1,170 doses in a tray. And unfortunately, what was happening was when the health department requested that that they get a batch of vaccines to take to a site, maybe 600 or 700, the entire 1,170 tray was defrosted, and it wasn't necessarily told to the folks in the health department that those remaining vaccines were in the refrigerator. And once they hit the refrigerator, the clock starts ticking. They have 120 hours to use them. So first and foremost, as with a lot of things, it seemed to be a breakdown of communication.
Thank you. Next, our question is from Jacob at the Memphis Business Journal.
Yeah, thank you. I am curious if you could explain a little bit more about the process for distributing into Shelby County going forward. You said it will not be going through the health department. You know, who exactly is getting the vaccine, and how will that then get to the vaccination sites?
Yeah, so while I'm answering this, I'm pulling up the list of where these vaccines are going to go. The bulk of them are going to go to the city of Memphis, who, as you know, manages some of the sites now, Appling and Pipkin, and then we'll be, I believe, bringing a Raleigh site on tomorrow. The other partners that will be receiving vaccine this week, there are hospitals, the multiple pharmacies, as well as the city of Memphis and FQHCs. In total, it looks like there are 15 hospitals, 9 FQHCs, 1 community health center, 1 independent pharmacy, 14 Walmart pharmacies, UT Health Science Center, and the city of Memphis. Those are the ones who will be receiving deliveries this week. And the inventory that is on Shelby County Health Department site now, in addition to those new shipments that are coming in, the inventory that is there will be parsed out to some of those partners on the list as well.
Thank you. Next up, we have a question from Corinne Kennedy at the Commercial Appeal.
Hi, thank you for taking the time today to update us. Dr. Piercy, you said a good relationship is built on trust and transparency. Do you feel that the Shelby County Health Department has been honest and transparent with you and with the public? And I'll have a quick follow-up.
I think there have been a series of miscommunications. I will say that at no time do I ever believe there was a malicious intent. There has been nothing nefarious uncovered, nothing intentional. A lot of processes as far as communication, not only between the health department and its pharmacist, but also the health department and the state, perhaps even the health department and the county and or the city have been lacking. And so we are there to remedy the problem and not to place blame. I can't speak to what Shelby County has or has not communicated with the public, so that would be a question for them.
And you mentioned that the Metro Health Department do have more independence. How much communication have you had with the Shelby County Health Department about vaccine management before this investigation started on Friday?
I'll ask Dr. Fiskus to answer that. She is the director of our vaccine program and is the one that has very frequent contact with not only our metro, but our rural partners as well.
Thanks, Commissioner. We have a bi-weekly touch point with all of the metros. There are statewide calls that are available twice a week for our metro partners, along with all of the other health departments across the state. And all of those health department leaders and those metro health departments know how to get a hold of us. They have our cell phone numbers and our email addresses, and they need to they know how to get a hold of us if they have questions or concerns. Additionally, as Commissioner Piercy said, vaccines are not new to any of the health departments. And so all of our metro health departments are also part of the Vaccines for Children program. They all have regional immunization representatives that are embedded in the metro health departments along with the regional health departments. And those are the subject matter experts around storage and handling of vaccines in those regions as well. And they get ongoing technical assistance from the state. So we feel like there's plenty of opportunity for education with those regional immunization representatives and availability and updates from the state.
Thank you. Our next question is from Gerald Harris at UT.
Now, you talked about the vaccinations not being on a couple of instances spoiling and being allowed to spoil. Are you 100% confident in the fact that this pharmacist did not give anyone any spoiled vaccinations?
So we don't have any evidence of that right now. However, I will acknowledge that we have made several data requests, some of which have not yet been fulfilled. And so I can't definitively answer that question, but I don't have any reason to believe that anyone got expired vaccine at this point.
Appreciate it.
Thanks, Gerald. Our next question is from Nikki with Fox 17.
Nikki, I think you're still on mute.
Forgive me. Yes, I was. Dr. Piercy, question for you. For people who live in counties that are slow to vaccinate, say that they've been on wait lists for weeks, what is the state doing to help those people? And why isn't there a uniform statewide system in place?
So as of last Monday, we did roll out a statewide scheduling platform for all of our 89 rural county health departments that are under the purview of the Department of Health. The system is pretty user-friendly. It has been rolled out in several states already. We've identified a couple of little minor bumps in the road, but the system seems to be working well. There were over 3,000 appointments booked in the first 24 hours. I personally was able to book my parents and in-laws, and it worked pretty good. They got an email confirmation. They go to the site. You either take the email information with you, or you just give your information when you get there and they can look you up. Obviously, for those who don't have access to technology, we still offer a telephone number option. But that system rolled out in the rural health departments last week. The metro health departments have been given the opportunity to get on that same system. Because of their size, we want to make sure we work out those couple of little kinks and wrinkles before we test it at scale in the larger metro health departments. We do anticipate that the Memphis Shelby County market will be the first metro that comes online in that system. It will likely be another 2 or 3 weeks before our technical folks can get some of those wrinkles worked out. And then we'll be able to go live in that metro and then in any other metro that is interested. To date, 5 out of the 6 metros want to come onto that system with us, and we have a plan to do that over the next few weeks. The 6th metro, I think, will probably come online as well, but that has been a big help as far as getting through those waiting lists and getting a much more efficient scheduling process.
quick follow-up for you. I know last time, I believe we did one of these briefings, you had talked about vaccine tourism and how the state strongly discourages it because it takes vaccines away from people that are in those counties. What do you say to people who are just desperate to get this vaccine, but they just can't seem to get one in their own county?
It is not a problem if they want to cross county lines. We encourage them not to do that, but I also understand that there are people that are very anxious to get their vaccine and are willing to travel to do so. At the end of the day, this is a federal resource. And so anyone in this country is entitled to this federal resource, regardless of county or even state of residence. Because we do have a population-based allocation, it works a lot better if you stay in your own county, but that is not an absolute restriction.
Thank you. Our next question is from David Riley with the Marion County News.
My apologies, had some technical difficulty. Dr. Piercy, again, wanted to thank you for taking the time to do these. Obviously, the hearing about the independent pharmacy at the metro location, is that something that is consistent with all 4 metro Department of Health?
So our 6 metro health departments each have provision for pharmacy services there because as Dr. Fiscus and I have both noted, storing vaccine and even medications are not new to health departments. And so you'll find a variety of either employed pharmacists or contract pharmacists, but all of the metro health departments do have some provision for management of their pharmaceutical products, usually vaccine, but also sometimes medications.
Okay, and is it just the scale then of the COVID vaccine that has kind of stress tested that relationship and that communication? In that respect, is that something that you can build on going forward with the metro areas?
So I don't believe that the relatively limited number of doses that the metro or any health department has gotten has really stress tested the system. They have been, health departments statewide, nationally, have been dealing with millions of vaccines for decades. So this, having a few thousand doses in the pharmacy is really not a heavy lift for a large metro health department. They're used to doing this. What it does tell us is that the processes that are not in place to safely store and handle COVID-19 vaccine may also indicate a more systemic issue in processes for other vaccines and pharmaceuticals. And so that's certainly something we'll be looking into, and something that we also have a vested interest in protecting is our VFC, or Vaccine for Children program.
Thank you. Our next question is from Blake Farmer with WPLN.
Hey, Blake, you're on mute.
I deserve a slap on the wrist for that. I am curious, you know, I mean, like you said, there's probably going to be a federal inquiry here. 2,400 doses and having this backlog. I mean, you know, around the country, people are going to be looking at this and saying, boy, I guess they could do a lot better in Tennessee. I wonder if you could just sort of share with us, I don't know, was this, you know, your worst fear, or, you know, kind of your personal response when you first learned how big this waste was in Shelby County?
My personal first reaction was, we have to make sure we get this right for the people of Shelby County. They deserve equal and effective and efficient access to this vaccine. So that was my very first thought. My next thought when I heard about the inventory was, we have to make sure this vaccine, that no more vaccine expires. We have to know when this vaccine is about to expire so we can deploy it as quickly as possible. We were able to get down there within a matter of hours and find that the excess inventory did have about 2 more weeks, which really relieved many of us. But it also created the impetus for having to deploy those pretty quickly. So I don't want to say it could be worse, but it could have been a lot worse. I'm glad we didn't find more of that. And further, it's really the time to problem solve and to set processes in place so this doesn't happen in the future. And not only for Shelby County, but it helps inform us about weak points or weak spots in any health department that could happen and keep us alert for those.
Thank you.
Dr. Piercy, if you've got time for one more, we'll take Jackie Massey from Fox 13.
How you doing? Thanks for your time. Just wanted to talk to you again about your surprise hearing that initially there's 1,300 vaccines discarded in Shelby County. Later that the 2,400 were discarded. So were most of those vaccines discarded because failures in the distribution process, like you guys mentioned? Like, what's the main cause of these vaccines expiring? And I have a follow-up question as well.
Sure. So all of the vaccines that were expired, they expired on 7 occasions and seven different events. Probably the thing that was most surprising and concerning to me is that we didn't, at the state vaccine program, we weren't notified of this for essentially a week after the last expiration event. And then we were only notified of 6 of those events and found out about the 7th one yesterday. It appears that all of these expirations occurred, as Dr. Fiscus explained, where an entire tray was defrosted or thawed out in the refrigerator, but then some of them, it was in excess of what was needed. And so instead of deploying or having a process for using those extra ones that had already been thawed and were soon to expire, they just sat in the refrigerator and were left unused. So they actually never left the pharmacy, to our knowledge. And so it was a process for, or I should say a lack of process for being able to manage those excess doses that were going to expire soon.
Sorry about that. Some issues with unmuting. And how long do y'all plan on being in Shelby County? And if these issues keep happening and we keep hearing about discarded vaccines, do you feel like a change in command might be the best bet for Shelby County? Is that something that you guys would like to see if this continues to happen even after you're here?
So we are definitely making very drastic changes in not only with the inventory on hand, but with all future allocations for the foreseeable future. I anticipate that we will have folks on site there for at least 2 to 4 weeks. And as I mentioned, we've requested CDC support for 30 days. That's subject to change. It could be that we can get this wrapped up in a pretty short time frame. It could be that after the 4-week mark, we see that significant intervention is still needed and will remain on site. There's really no higher priority in the state right now than making sure that we get this right in Shelby County. And so we're willing to put whatever resource we need.
Thank you. Dr. Piercy, do you want to take one more?
Shelly, I see 3 people with their hands raised, and we can get to them.
Okay, we'll go next to Rebecca Bitcher from Local 24.
Hey, I think my question just got answered a little bit, but I was just going to ask just how long the monitoring would last, how long you guys, if there's any set date of how long you guys would be here monitoring the distribution process.
We're targeting 30 days right now. It could be a little shorter, could be a little longer, but that's what we're targeting right now.
Okay, thanks.
Thank you, Rebecca. Next up, we have a question from Vivian Jones. I'm sorry I can't see your outlet, but go ahead, please.
Thank you so much, Commissioner Piercy, for taking our questions today. My question for you is, you mentioned a possible federal investigation. I wondered, had you had any conversations with federal authorities? Have they already reached out to the state? And if so, have they indicated any timeline for that potential investigation?
So it's my understanding that although we have made our federal partners aware that the Shelby County Health Department has not yet logged those wasted doses into the federal system, that is typically the trigger for the federal partners to reach out to the local entity. You'll recall we had a pretty significant wastage event in Knox County a few weeks ago. That's exactly how that process happened. But we have notified the federal authorities, but it's my understanding that until it's officially logged by Shelby County, that's what will trigger that.
Thank you.
Thank you. Next up, we have Latricia Thomas from WTVC.
Hey, Dr. Piercy, wanted to go back to the teacher-specific pods that are going on in some rural health departments there. Are you encouraging the metro health departments to also do that? And if not encouraging them specifically to do that, do you think it's something they should be doing? So like you said, teachers can have access to those appointments when they don't also need to be in the classroom.
Sure. Yeah, that's a great question. And many of our Metro partners are already doing that. I believe Metro Nashville had a big event this past Saturday. I believe that went forward, even despite the weather, because I think the weather broke on Saturday. So that was a good way to handle teachers that have to work during the day. It doesn't really make a lot of sense to only offer off-site vaccinations while we know they're in school. So whether that is coming on-site to the school during work hours or hosting pods after hours or nights or weekends, that's what we need to get our teachers vaccinated. And that would be the same all across the state, whether it's metro or rural.
Okay, thank you. We're specifically in Hamilton County, and I think they're waiting on a pharmacy to get vaccine supply to do that separately, but the Metro Health Department is not setting aside any of their doses, which is leading to some frustration for our teachers here.
Yeah, as I understand it, Hamilton County will be getting the contracted school health provider will be getting a direct allocation. And so it will not come out of Hamilton County Health Department's allocation, but rather will be directly allocated to the school health provider there.
Thank you.
Thank you. We do have one final question from Shay Arthur at WREC.
Hi there. Thanks for taking my last question here. Just to be really, really clear here, Dr. Piercy, when we talk about those 30,000 excess doses that essentially have just been sitting on a shelf, just want to be clear, they should have been administered at some point already, right?
That's a good question for Shelby County Health Department. What I can tell you is that based on what we know about the normal cadence of first doses and second doses, we estimate that it would be expected to have about 20,000 in inventory. The extra 30,000, I don't have an answer of why those weren't administered. I don't have any indication if they were stockpiling those or if it was an inefficient process. I don't have any optics on that.
And for those vaccines that expired, do you have any idea about the monetary loss on that?
I do not believe I've ever been told about any monetary value of this. As the commercial says, it's priceless.
Thank you.
Thank you, Dr. Piercy. That is the end of the questions that we have in queue. I thought perhaps you might revisit your messaging on second doses because we have received a lot of questions about that.
Sure, yeah, happy to. So when you get a first dose vaccine, there are some sites that go ahead and schedule you for a second appointment, and some other sites you'll need to schedule that separately. However, the thing that's important to know is that not only are you building really good immunity after the first dose, you have up to 6 weeks to get the second dose. So when you get your immunization card, there will be a date written on there. It will likely be 3 weeks from the day you got your first Pfizer vaccine or 4 weeks from the date where you got your first Moderna vaccine. That date is the earliest which you can get your second dose. It does not mean you have to get it on that day. It means you just can't get it before that date. The CDC has come out and said you have up to 6 weeks from the first dose to get your second dose, and there is absolutely no interruption in any of your immunity building. So I know a lot of people are anxious, particularly if their appointment was scheduled for last week and had to be rescheduled because of weather. You are perfectly fine as far as building immunity. You have up to 6 weeks to get that second dose, and we will get you a second dose if you are due it. So I just wanted to give you some reassurance that you don't have to start over and you're not going to lose immunity by waiting another couple of weeks. Thank you, Shelley, and thank you, everybody. We'll circle back when we have more information.
Thank you, everyone. That is our time for today. We appreciate you joining us. As always, should you have additional questions, you may reach out to me